Most people think multiple sclerosis only affects movement, balance, or vision. But what many don't realize is that MS can also disrupt the body's entire hormonal system. Multiple sclerosis, or MS, is a chronic autoimmune disease in which the immune system attacks the protective myelin sheath surrounding nerve fibers in the central nervous system. This damage interrupts communication between the brain and the rest of the body. While MS is primarily classified as a neurological disorder, its effects extend far beyond the brain and spinal cord. One of the most overlooked areas affected by MS is the endocrine system. The endocrine system is made up of glands such as the pituitary, thyroid, adrenal glands, pancreas, and reproductive glands, all of which produce hormones that regulate metabolism, growth, stress response, sleep, energy balance, and reproduction. Because the brain plays a central role in controlling hormone release, neurological damage caused by MS can interfere with hormonal signaling pathways and disrupt normal endocrine function. This can contribute to symptoms that many patients experience daily, including fatigue, mood changes, sleep disturbances, weight fluctuations, and reproductive problems. In many cases, these endocrine effects develop gradually and may go unrecognized for years, making comprehensive assessment extremely important. One of the most important regions involved is the hypothalamus and pituitary gland, often referred to as the body's hormonal control center. The hypothalamus connects the nervous system to the endocrine system by sending signals to the pituitary gland, which then regulates hormone production throughout the body. MS-related inflammation, lesions, and demyelination in the brain can disrupt this communication process. When these signals become impaired, hormone production may become either excessive or insufficient. This can affect stress hormones, thyroid hormones, reproductive hormones, and metabolic regulation. Fatigue, one of the most common and disabling symptoms of MS, is closely linked to endocrine dysfunction in many patients. Hormonal imbalances involving cortisol, thyroid hormones, or sex hormones may worsen exhaustion and reduce the body's ability to recover from stress. Sleep disturbances commonly seen in MS can also affect hormone secretion, particularly melatonin and cortisol rhythms, creating a cycle of chronic fatigue and poor energy regulation. In addition, hypothalamic dysfunction may contribute to temperature regulation problems, appetite changes, and disturbances in thirst and hydration balance. The hypothalamic pituitary adrenal axis, also known as the HPA axis, plays a major role in how the body responds to physical and emotional stress. This system regulates cortisol production from the adrenal glands. Cortisol is essential for maintaining blood pressure, regulating metabolism, controlling inflammation, and helping the body adapt to stress. In multiple sclerosis, chronic inflammation and immune activation can dysregulate the HPA axis. Some patients may develop persistently elevated cortisol levels due to ongoing stress and inflammation, while others may experience impaired adrenal responsiveness. Abnormal cortisol regulation can contribute to severe fatigue, weakness, mood instability, anxiety, sleep problems, and impaired immune control. Long-term corticosteroid treatment used during MS relapses may also affect adrenal gland function. Repeated steroid therapy can suppress the body's natural cortisol production, leading to adrenal insufficiency if not properly monitored. This is why gradual tapering of steroids and careful endocrine evaluation are important during long-term MS management. Emotional stress itself may worsen MS symptoms and trigger flare-ups, further linking endocrine and neurological dysfunction together. Thyroid dysfunction is also significantly more common in individuals with multiple sclerosis compared to the general population. Autoimmune thyroid diseases such as Hashimoto's thyroiditis and Graves' disease may occur alongside MS because both conditions involve abnormal immune system activity. Thyroid hormones are essential for regulating metabolism, energy production, body temperature, heart rate, and cognitive function. When thyroid hormone levels become abnormal, symptoms such as fatigue, depression, muscle weakness, weight changes, constipation, anxiety, and impaired concentration may worsen. In some patients, thyroid dysfunction may even mimic MS progression, making diagnosis more challenging. Certain disease-modifying therapies used in MS treatment may also increase the risk of thyroid abnormalities. For this reason, regular thyroid function testing is often recommended, especially in patients with unexplained fatigue or metabolic symptoms. Proper management of thyroid disorders can significantly improve overall energy levels and quality of life in patients with MS. Reproductive and sexual hormone function can also be affected in multiple sclerosis. Women with MS may notice worsening neurological symptoms during menstruation due to hormonal fluctuations. Pregnancy often has complex effects on MS activity, with some women experiencing symptom improvement during pregnancy but increased relapse risk after delivery. Menopause may also worsen fatigue, cognitive symptoms, and mood changes due to declining estrogen levels. In men, low testosterone levels may contribute to fatigue, depression, reduced muscle mass, and decreased motivation. Sexual dysfunction is common in both men and women with MS and may result from a combination of neurological damage, hormonal imbalance, fatigue, emotional stress, and medication side effects. Patients may experience decreased libido, erectile dysfunction, difficulty achieving orgasm, or reduced sensation. These issues are often underreported but can significantly affect emotional well-being, self-esteem, and relationships. Psychological support and hormonal assessment may help improve quality of life in affected individuals. Vitamin D plays a particularly important role in both bone health and immune system regulation. Research has shown that low vitamin D levels are associated with increased risk of developing MS, as well as increased disease activity and relapse frequency. Vitamin D may influence immune responses by helping regulate inflammatory pathways involved in autoimmune disease. Because of this, many neurologists recommend regular monitoring of vitamin D levels and supplementation when needed. Adequate calcium intake, physical activity, and weight-bearing exercises are also important for maintaining skeletal health and reducing complications related to osteoporosis. Management of endocrine dysfunction in multiple sclerosis requires a multidisciplinary approach involving neurologists, endocrinologists, rehabilitation specialists, nurses, nutritionists, and mental health professionals. Regular hormonal assessments may be necessary to identify thyroid disease, adrenal dysfunction, vitamin deficiencies, reproductive hormone imbalances, or metabolic disturbances. Treatment focuses on correcting hormonal abnormalities while continuing neurological management of MS. Lifestyle interventions also play a major role in supporting endocrine health. Balanced nutrition, adequate hydration, stress reduction, physical activity, sleep optimization, and emotional support can all improve hormonal regulation and overall well-being. Exercise programs may help improve energy levels, muscle strength, mood, and metabolic health. Stress management techniques such as mindfulness, counseling, and relaxation therapy may reduce cortisol dysregulation and improve coping abilities. Ultimately, multiple sclerosis is not only a neurological disease but a complex systemic condition that can significantly influence endocrine function and hormonal balance. Understanding this connection is essential for providing comprehensive care, improving symptom management, and enhancing long-term quality of life for individuals living with MS